Desmond, welcome to the New Zealand Leech Therapy Clinic.
Thank you, Tracy.
You've obviously come over from Australia, where you first underwent leech therapy in 2008.
That's correct.
Would you just explain what your symptoms were and how leech therapy helped you during your first treatments?
Well, I had a stent put in, and a subsequent examination showed that I had further blockages in the same artery.
Yeah.
And that was a matter of concern. And since then I learned about what Mehdi is doing, and I thought I'll have a go at it. And I went through the therapy and found that my arteries were cleaned by the therapy. That took me through for a few years, and even the doctors were surprised that there could be such a change in the blockage of the arteries.
Yes, yes. So before you had, was it an angiogram you had before? What was the difference, or what were the tests that were done that showed the difference of the...
Well, I had an angiogram done.
Yes.
And that showed that I had the arteries blocked, or artery rather, which was blocked in two places. One at the stent and then beyond the stent.
Yes.
And after I went through the leech therapy, the arteries were clear.
And how soon after your first leech therapy treatment did you have...
Stress vessel angiogram.
Ah, yeah. Did you have another angiogram?
Subsequent to the leech therapy, yes, I did have one. And it was all clear.
Yeah. And so how long after the leech therapy? Of course it is. But I mean, look what it did for you. I mean, that's the, that's why you know.
That's what people need to know, is educate the people. That's what the leeches can do.
I know.
Clear the cholesterol. We don't talk about the blood clot here, we talk about the cholesterol.
Because obviously, in your situation, where you had the stent, you had an airing further up, and they're not able to put another stent.
The result of that only alternative is bypass.
Of course.
That's what Desmond come to see me first. We discussed. He said, if they're not, I don't want to have a bypass.
No.
That's what you come and you see the very good results.
Well, the bypass, gosh, the recovery time, and it just, like any major surgery,
puts you off
really
for a few years.
And
it's an intrusion into your body.
Absolutely.
You don't want that.
No.
Well, this is harmless.
Yes.
If it doesn't work, who cares? But it has worked. That was my initial attitude.
Now you know.
Yes, because like any normal person, I was skeptical.
Yeah.
But I tried it and experienced it, and now I'm a believer in it.
Well, when you see results before and you see results after, you can't argue with that.
Yes. It's not my making the assessment. It is the professionals who make the assessment.
Absolutely. Out of interest, what did your doctors or your cardiologist, when they had found out that you had undergone leech therapy, what was obviously they were surprised.
Yes.
Had they heard about therapy being given for this before?
Yes. My GP was surprised, and he had nothing to say about it, though he was surprised at the results. Initially he discouraged me, and he said, "You're wasting your money."
So that's the thing, you see, all medical professions, they always, because they don't know enough about it.
And they do not want to take their risk. And I told him, this is what I'm going to do, and he said, "See, you're wasting your money and time, and all these kind of things." I said, "Fair enough, but there is no harm, so I'm trying it." And that's how I kept him informed, and that's how I went and saw him to the end. After doing that, and he, as a professional, he had to, get his reports so that he can confirm that what I am saying is correct. So I went for another stress test and angiogram and these kind of things. I feel more relaxed. I feel more comfortable. I feel I'm healthier. I can't recommend anything better because I've experienced it and I benefited from it. So I would recommend anyone to try it.
Thank you very much, Desmond. I appreciate your sharing your experience.
Thank you for your support during the process and the treatment, Tracy.
You're very
You've
welcome.
been very welcome. I'm sorry, very helpful and supportive of it. And let's hope there will be more people who you will help and who will benefit from this.
Absolutely.